All right, now we move on to health matters, where World Health Organization has announced 25 cases of fresh coronavirus disease, that's COVID-19 infections in Benue State, north-central Nigeria. The World Health Organization surveillance officer for Benue State, Ogechukwu Chigbo, made this known at a one-day civil society organization, CSOs and media engagement orientation meeting on COVID-19 ramp-up in Makurdi, the state capital. A surveillance officer cautioned that COVID-19 was still prevalent, advising that people take advantage of the availability of vaccines to protect themselves from the virus. Chigbo pointed out that the global organization has decided to integrate COVID-19 vaccination into the routine immunization exercise to drive the coverage in the state further. All right, to further discuss this, I'm being joined by a medical virologist at Adeleke University at Osun State. He is also, his name is Oladipo Kolawole. He is also an associate professor at University of Birmingham, UK. Good morning, Oladipo, and thank you so much for joining me.
Thank you for having me. Yeah, thank you.
All right, we're seeing a resurgence of COVID-19. Are there any new variants of the virus or even factors that are contributing to the resurfacing of COVID-19 in Nigeria, especially in Benue State?
Well, the report that came out yesterday has two sides. You can discover that the report was made by the surveillance officer of WHO. At the same time, up to now, you can see that NCDC, who is in charge of our health, the Center for Disease Control, is yet to make a scientific statement that this report is either yes or no for now. So, and if you see from the report, we cannot say that this is a particular strain that was discovered or detected in Benue. So what they do for now is just testing and saying that they are positive to the virus. So, and for now, we have several strains that is circulating in different locations in the country and in the world at large. So until a further testing is done by doing the genetic sequencing, then further analysis, we can be rest assured the kind of strain that is circulating. Now we have new strains circulating and defined by each geographical location in each country or part of each other country.
All right, Oladipo, while we wait for further testing, can you tell us what are the main challenges, being faced in controlling the spread of COVID-19, particularly in Nigeria?
I think from one of the factors I've seen is our attitude to vaccination. The reason why we had people getting vaccinated at the time is because there was a complete sensitization. If you look at the data released by the National Primary Healthcare Development Agency, that as of October, we have 70% of Nigerian population that have been fully vaccinated, and that's around 17.5 million, if I'm very correct. If you look at the ratio compared to the total population of Nigeria, and you find the percentage, discover that we have like 8.75% of Nigerian population that is fully vaccinated. You see that we have a long way to go. That is why I find it encouraging for integrating COVID-19 in normal routine immunization. But we have to do a lot of community sensitization, telling our people that they need to be fully vaccinated. When we say fully vaccinated, what we mean is that you get your first dose, your second dose, and your third dose if possible. That's your booster. And we have like 80% of the population that have gotten one dose that are yet to get the second and the third dose. And now the vaccine is still available in the community, in the country. So we need to sensitize our people to be fully vaccinated, get your first shot, get your second, and if possible, get your third. The reason why we had a lot of people getting vaccinated at the time because it became a criteria for people to travel out of the country. Now that is no more a criteria for travel, so people felt I don't need to be vaccinated. And that is why we are seeing cases now coming up. And truth be told, The virus is circulating.
All right, Oladipo. While we're actually still talking about, vaccination, there's a reason why a lot of people, find it difficult to want to get vaccinated. Now, the surveillance officer for the WHO in Benue State stated that there are a lot of negative rumors about the COVID-19 vaccines, and this is where misinformation or even disinformation actually comes in. So, aside trying to enlighten people to, get their vaccines, what other strategies are being implemented to address vaccine hesitancy, especially when it comes to misinformation in Nigeria?
I think one of the things we have been doing is doing something like this. I know national registration agencies have been talking about it. We have different non-governmental organizations that is pulling data across to people to let them see that this thing is working. Even me personally, in my own research team, I have conducted studies that are put up for publication that I can't be talking about it to let it show you that the vaccine is actually working, because I was able to look at cohort of those who are vaccinated and not vaccinated, and I checked how they will react if the virus will get in contact with the virus, and discover that being vaccinated is the best thing. So we have people who are called anti-vax. It's not about COVID-19. They are already there telling you that you don't need to get vaccinated, every other thing. But the truth be told, getting vaccinated is the best. But there is one myth that I want to let people understand. Because you get vaccinated doesn't mean that you can't catch the pathogen, the virus. What it means that there is the severity of the disease. So the idea that once I got vaccinated, I should not come down with the disease is not scientifically a good idea. So what is there is that you have enough protection so that you're not being weighed down by the disease. Your system, your immune system, your soldiers of the body will have the tendency to fight, and that will reduce hospitalization, whereby you can now go on with your daily business. Instead of using a week on the hospital bed, then you can use just 2 or 3 days, then you get over it, then we'll move on with it.
All right, we sincerely hope that the effectiveness and also the effectiveness of testing and also contact tracing in Nigeria, especially in Benue State, is actually improved to bring an end to the prevalence of COVID-19, at this time. Thank you so much, Oladipo Kolawole, for joining me on the news to give your opinion on this.
Thank you for having me on this news.